Coming into the RIIN program, I didn't know what to expect. After 51 hours of provider observation, 2 healthcare facilities, and one amazing Alaskan adventure, I know now I couldn't have expected how wonderful of an experience I was going to receive. As I landed in Anchorage on July 12th, I knew my adventure had begun. As we learned about Alaskan culture and Alaskan healthcare, I didn't know how relevant this information would be to my experience in my rural site, since I was in a more urban setting. I was soon going to find out that even though I was in a more urban setting, all of this information would still apply. I was first placed in Soldotna at Central Peninsula Hospital in their oncology unit. This is where I spent 20 hours in 3 days seeing how nurses could make an individual's treatment a little less painful. Every nurse knew every patient's name and did their best to cater to the patient and the patient's family's needs. These nurses worked with other providers to provide the best care possible. From Soldotna, I went down to an eclectic art town with a fishing problem. This was the quaint town of Homer. Here I shadowed at Scott's Family Pharmacy, where I received a pharmacy experience like I never have had before. The pharmacist and pharmacy technicians worked 9 hours a day, 6 days a week, trying their best to fulfill the pharmaceutical needs of the community. This was typically seen in giving patients the best price for their medications while still being able to keep the doors of the pharmacy open. Even though I was in larger cities, I saw the hardships healthcare can have on individuals when practicing medicine in the great state of Alaska.
Stepping off the plane in Petersburg, I wasn't sure what to expect. I came with an open mind and ready for just about anything. However, what I experienced during my time in Petersburg was more than I could have ever hoped for. Petersburg is a charming little community located in southeast Alaska. The town is known for its Norwegian culture and fishing industry. However, the best part of Petersburg is the people. From the moment Rachel and I arrived, we were welcomed with open arms. Each person we encountered was genuinely excited to have us visiting. This made our time all the more enjoyable. I quickly learned that Petersburg is a very close-knit community, and everyone knows everyone. As a healthcare provider, this means your patients will most likely be familiar faces, maybe even a close friend or family member. I shadowed medical professionals who really knew their patients and strived to give them the best possible care. I believe they raised the standard of care to a whole new level. Being a small hospital on an island means that the Petersburg Medical Center has to work with what they have. They may not have many specialty areas, but they do have healthcare providers that go above and beyond to compensate. I watched a primary care doctor call upon her knowledge of optometry in order to diagnose a patient. I witnessed physical therapists provide one-on-one hour-long therapy sessions where they were the direct monitors rather than a tech or PTA. I observed a public health nurse comb through vaccination records so she could send out reminders to families telling them which vaccinations their children needed and information on those vaccinations. Again and again, I was blown away by how hard these providers worked and how passionate they were about their jobs. I came into this experience hoping to determine whether or not my future lies in rural medicine. I can now move forward knowing this is the exact environment in which I wish to practice. I am beyond thankful for this experience and the valuable lessons I learned along the way.
Bethel is a city in the tundra, a landscape of winding rivers and melting permafrost. It is home to the main hospital serving the Yukon-Kuskokwim region, an area about the size of Oregon containing several rural villages. The vast distances between the communities and hospitals presents challenges in providing patients with the care that they need. I was interested in seeing how this care was achieved and how the duties of the providers broadened and became more flexible as a result of limited staffing. In Bethel, the range of responsibilities that providers encounter are much broader than what I have seen in the lower 48. Much of the time, the specialists that are needed are not available in emergency situations, and the providers who are present are responsible for either caring for the patient or stabilizing them so they can be sent to a hospital where the proper specialist is located. This is part of the reason why working here in the future is so appealing to me. Each day is different from the last, and you never quite know what to expect. When I told people in Anchorage that I was going out to Bethel, it seemed that no one had anything nice to say about the city. When I arrived, I didn't find myself agreeing with this at all. It's flat, and there's not much to do, but the tundra is beautiful. It's full of berries to eat and rivers to kayak in. A new fitness center complete with exercise classes and a pool has been a recent addition to the city, which is a great place for bettering the health of the residents, especially during the long, cold winters. The overall feeling of the city for me was that it was a kind and accepting community. People who I had never met before on the street always smiled and waved to me as we passed each other. I doubt that the people who told me that Bethel was a place to avoid had ever really been there themselves.